How effective are tumor treating fields for brain cancer? Imagine a treatment that uses gentle electric fields to fight cancer cells without surgery or drugs. That's what tumor treating fields are designed to do. They are a non-invasive, FDA-approved therapy mainly used for glioblastoma, the most common and aggressive brain cancer. This treatment involves placing transducer arrays on the scalp, which deliver low-intensity, alternating electric fields directly to the tumor. These fields interfere with how cancer cells divide, causing them to die while sparing most normal brain cells. Because glioblastoma cells divide rapidly, they are particularly vulnerable to this approach. The first FDA approval came in 2011 for patients with recurrent glioblastoma. This was based on a clinical trial showing that tumor-treating fields worked about as well as chemotherapy but with fewer side effects. In 2015, the FDA expanded approval for newly diagnosed glioblastoma after a larger trial called F14. This study found that adding tumor-treating fields to standard chemotherapy increased the median time patients lived without their cancer worsening for to nearly 7 months. It also improved overall survival from about 16 to over 20 months. Importantly, the treatment caused minimal additional side effects, mostly skin irritation where the electrodes are placed. Research shows that patients who use tumor-treating fields tend to live longer and maintain a better quality of life compared to those who only receive chemotherapy. The more consistently and effectively the electric fields are delivered, the better the outcomes tend to be. The most common side effect is localized skin irritation, which can usually be managed easily. Because it does not cause systemic toxicities like nausea or immune suppression, many patients tolerate it well. Scientists are also exploring how tumor-treating fields might boost the immune system's ability to attack tumors. Some evidence suggests that the electric fields can attract immune cells to the tumor area, possibly making other treatments like immunotherapy more effective. Combining tumor-treating fields with surgery, radiotherapy, chemotherapy, and targeted therapies is an active area of research, aiming to improve outcomes further. While tumor-treating fields have shown meaningful benefits, it's important to remember that glioblastoma remains a very challenging cancer to treat. The therapy is not a cure but an important addition to standard care. Ongoing studies are working to optimize how the electric fields are delivered, how they work with new drugs, and whether they can be used for other types of brain tumors. In summary, tumor-treating fields are a safe and effective treatment option for brain cancer, especially glioblastoma. They can extend survival and help patients maintain their quality of life when used alongside chemotherapy. As research continues, scientists hope to improve how this technology is used and expand its benefits. If you or a loved one are considering this treatment, it's essential to discuss with a neuro-oncology specialist to see if it's suitable for your specific situation. Always relying on your healthcare team for personalized advice and guidance.